Blood sugar test, blood glucose test. A blood sugar test, also known as a blood glucose test, measures the amount of glucose, a type of sugar, in your blood. Glucose is the body's primary source of energy, and its levels are primarily regulated by the hormone insulin. Definition: blood sugar, glucose, is the main sugar found in your blood and comes from the food you eat. It's your body's primary source of energy. A blood sugar test measures how much glucose is currently in your bloodstream or, in the case of the A1C test, provides an average over a period of time. Methods of measurement and instruments used. There are several methods and instruments used to measure blood sugar. 1. Fasting blood sugar, FBS, test. Method. A blood sample is taken after you haven't eaten anything for at least 8 hours, usually overnight. Instrument. Typically, a blood sample is drawn from a vein, venipuncture, and sent to a laboratory for analysis using automated analyzers. 2. Random blood sugar, RBS, test. Method. A blood sample is taken at any time of the day, regardless of when you last ate. Instrument. Similar to FBS, a venous blood sample is usually taken and analyzed in a lab. In some cases, a point-of-care glucometer, blood glucose meter, can be used for a quick, less accurate reading from a finger. 3. Oral glucose tolerance test, OGTT, method. After an overnight fast, a fasting blood sample is taken. Then, you drink a specific amount of a sugary liquid, and blood samples are taken at regular intervals, e.g., 1 hour, 2 hours, and sometimes 3 hours, to see how your body processes the glucose. This is often used to diagnose gestational diabetes. Instrument. Venous blood samples are taken and analyzed in a laboratory. 4. HbA1c test, glycated hemoglobin test. Method. This blood test measures your average blood sugar level over the past 2 to 3 months. It measures the percentage of hemoglobin, the oxygen-carrying protein in red blood cells, that has glucose attached to it. Instrument. A blood sample is drawn from a vein and sent to a laboratory for analysis using specialized equipment that quantifies glycated hemoglobin. 5. Home blood glucose monitoring, HBGM, method. Individuals, especially those with diabetes, regularly test their own blood sugar levels using a small drop of blood, usually from a fingertip. Instruments. Blood glucose meter, glucometer, a small, portable electronic device that reads the glucose level from a disposable test strip after a drop of blood is applied to it. Lancet device, lancing device, and lancets. Used to prick the fingertip to obtain the blood sample. 6. Continuous glucose monitoring, CGM, method. A small sensor is inserted under the skin, usually on the arm or abdomen, and continuously measures glucose levels in the interstitial fluid throughout the day and night. Instruments. Sensor. A small, disposable device placed under the skin. Transmitter. A small device worn on the body that sends data from the sensor wirelessly. Receiver or smartphone app. Displays the real-time glucose readings, trends, and alerts. Normal ranges. Normal blood sugar ranges can vary slightly depending on the test and individual factors, but general guidelines are: fasting blood sugar, FBS, normal, less than 100 mg per deciliter, 5.6 mmol, L, prediabetes, impaired fasting glucose, 100–125 mg per deciliter, 5.6–6.9 mmol, L, diabetes, 126 mg per deciliter, 7 mmol, L, or higher on 2 separate tests. Random blood sugar, RBS, diabetes, 200 mg per deciliter, 11.1 mmol, L, or higher, especially with symptoms of diabetes. A single reading often requires confirmation with another test, like FBS or OGTT. Oral glucose tolerance test, OGTT, 2-hour post-glucose load. Normal, less than 140 mg per deciliter, 7.8 mmol, L, prediabetes, impaired glucose tolerance, 140–199 mg per deciliter, 7.8–11.0 mmol, L, diabetes, 200 mg per deciliter, 11.1 mmol/L, or higher. HbA1c test, normal, below 5.7%. Prediabetes, 5.7% minus 6.4%. Diabetes, 6.5% or higher on two separate tests. Note, for individuals with diabetes, target ranges for blood sugar are typically individualized by their healthcare provider. General targets for adults with diabetes might be: before meals, 80-130 mg per deciliter, 4.4-7.2 mmol/L, 1 to 2 hours after meals. Less than 180 mg per deciliter, 10.0 mmol/L. Clinical significance. Blood sugar tests are clinically significant for 1. Diagnosis of diabetes and prediabetes. Consistently high blood sugar levels indicate diabetes, a chronic condition where the body either doesn't produce enough insulin or can't effectively use the insulin it produces. Prediabetes indicates blood sugar levels that are higher than normal but not yet high enough for a diabetes diagnosis. It signifies an increased risk of developing type 2 diabetes and other health complications. 2. Monitoring diabetes management. For individuals with diagnosed diabetes, regular blood sugar testing, especially with glucometers and CGMs, helps them and their healthcare providers track the effectiveness of treatment plans, medication, diet, exercise. It helps identify patterns of high blood sugar, hyperglycemia, or low blood sugar, hypoglycemia, allowing for adjustments in medication doses or lifestyle. 3. Preventing complications. Maintaining blood sugar levels within a target range is crucial for preventing or delaying long-term complications of diabetes, which include cardiovascular disease, heart attack, stroke, atherosclerosis, nerve damage, neuropathy, numbness, tingling, pain, kidney disease, nephropathy, leading to kidney failure, eye damage, retinopathy, leading to vision loss or blindness, foot complications, ulcers, infections, potentially requiring amputation, acute complications, diabetic ketoacidosis, DKA, and hyperosmolar hyperglycemic state, HHS, very high blood sugar, and severe hypoglycemia, very low blood sugar, which can be life-threatening emergencies. 4. Screening for gestational diabetes. Important for pregnant women to identify and manage gestational diabetes, which can impact both maternal and fetal health. Thank you.